Hi, in this session we will talk about depart. Depart is the way to discharge a patient from the hospital. The depart button is sitting on the top in the top line here where it says depart. One can also get into depart by going down and clicking depart process here if you don't see the button. So I'll use this button to launch the depart module where we can see the depart window has opened, and we can see that for us to do the discharge correctly, we'll have to do items 1, 2, 3, 4, and 5 here. The first step is medication reconciliation. So in order to launch medication reconciliation, one would click on this pencil icon, in which case medication reconciliation will open up. Here, basically what has happened is any inpatient meds you see by this icon have gone to a discontinue. Any home meds have defaulted to a continue. Home meds are these scroll icons. And one can also then add prescriptions. So for instance, if I wanted to prescribe azithromycin, I would click add. I would type in Notice how azithromycin comes up. Maybe I want to prescribe azithromycin 1 tab for 5 days. And so in this way I'm adding a prescription to this patient. And notice how it's defaulting to do not send to pharmacy because this is a fake patient. So a new prescription got added for azithromycin. They're not going to go home on doxycycline. They will go home on Pepcid as their old home med, and Percocet as a old home med, and continue their aspirin. And therefore the inpatient aspirin has been discontinued. So they're going to go home on 4 meds, and here you would click sign. And you see here that the medication reconciliation has been completed. The second step is to put in a diagnosis. So one would click on the tab and add a diagnosis to the chart. And you would, for instance here, search UTI as an example. And search and say bacterial UTI as an option. Select that, click OK. And notice bacterial UTI got added here. And then you would click OK. Make sure you do not click close. You would click OK. And notice how bacterial UTI got added. Additionally, you can take this bacterial UTI and drag it down and create a problem out of it, such that this is a chronic problem perhaps that they may be dealing with. You could have had put in diabetes and put it in this section. You could alternatively click this add button and add diabetes to this section in a similar way. So then you click close and you see bacterial UTI is added. Next is to add discharge instructions. Click on the pencil icon and quickly go through any kind of discharge needs. One, you must pay attention to the blue as basic instructions, so like regular diet, no limitations, full CPR, home treatments. Maybe there's none, in which case if there's none, don't select any. Maybe they don't need blood glucose monitoring, leave it empty. Do they need any DME ordered? If they do and they're a home care patient, Medicare patient, if you click home care, a special screen opens up that is the face-to-face Medicare. Here you would just put in the needs as to why they need home care. Maybe they need physical therapy, maybe they have diabetes and a fracture, maybe they have impaired mobility, maybe they need they have profound weakness, in which case you would highlight certain things on this form that are needed. And simply you would put in by your date. By putting in a date and time, by clicking on these arrows, you have now authenticated it. In order to authenticate this information, you would click not on the pencil but on this return form, and then click on this green sign form, and therefore you have now kind of put in the appropriate authentication that's needed for a patient for discharge. Next is the follow-up date. You click on follow-up date. A follow-up window opens where you could type in the last name of the provider. So for instance, or you could type in free text. You could say PCP and you would click add, and then it would say when do you want them to follow up with their PCP. Maybe you'll select 7 to 10 days, but you could select other options as well. And then any quick added items. Notice how PCP got selected down here. And this red X basically deletes the PCP, meaning you can, if you made a mistake, you can remove this instruction. However, when you highlight it, you can actually type what you want. Bring medications to this visit. Call with INR results to PCP. Something like that. And then click sign. Once you click sign here, you will have completed the follow-up as well. So to reiterate, you need to complete steps 1, 2, 3, 4, 5 to complete D part correctly. And notice how they're grayed out and check marks are there. And then you would click you could click on patient summary and note how everything we just did got captured. This data actually goes to be printed and to be sent with the patient, anything that's done in D part in steps 1 through 5. So you'd click sign and close, and at that stage you will have completed D part. Of note, you must make sure that there's a discharge order, and we didn't do that. However, if I launch it again, you will see that there's an order to discharge a patient, in which case you would click the pencil. You would select the discharge patient to order. You would say perhaps home with no home care services. Click OK. Click done. And then notice this order is sitting here to be signed, home with no home care services. Click sign, and that will place the home discharge to home order in here. And then you would click sign and close, in which case you will have correctly completed D part. And that's how you discharge a patient.